So, good afternoon, everyone. This is the Mental Health Department of the NGO Voice Cyprus. Hope you're all safe, social distancing, and following the precautions. Today, we want to talk about the stigma associated with mental illness, and we know that mental illness is common, painful, and potentially deadly. But the public perception of mental illness in most communities lies decades behind what science is telling us today, and the stigma associated with it strongly exists till this day. I'm so excited to discuss all this in an interview with Ms. Akile Zorba, whose PhD investigated public stigma in the Greek Turkish-speaking Cypriot community and how it would impact the public attitude towards these issues. And we will also talk about the COVID-19 and the stigma associated with being infected that is sparking up in some communities now. Ms. Akile's research interests are primarily in the areas of social psychology, public health, with an emphasis on culture. She's currently part of a research team that is exploring the use of assistive robots in health and social care. Welcome, Ms. Akile. It's an honor to have you with us today.
Thank you so much. Thank you for giving me the opportunity to talk.
Well, so we can start now with our first question. Can you explain to us what exactly is stigma and its definition?
In general, stigma could be defined as perceived negative attributes that causes someone to think less of a human, or think that the individual is someone to be devalued for. But I can explain stigma using actually three interacting elements, which are beliefs. For example, individuals with mental illness are dangerous. And if we believe in these things, then we may end up developing negative attitudes towards these individuals, such as I dislike individuals with mental illness because I believe that they're dangerous, which can then lead us to show discriminating behavior. For example, not renting the house to individuals with mental illness, or not employing them simply because they have such mental health problems. This is the public side of stigma, but we should also acknowledge that there is self side of it as well. So people with mental illness can actually have these negative beliefs about themselves as well, which can then lead them to isolate themselves from the community too. So when we think of stigma, yes, there is a public side of it where public shows these negative attitudes, but also people can direct these negative attitudes, unfortunately, towards themselves as well.
All right. So what do you think exactly are the main causes of stigma or discrimination regarding mental health?
There are many causes of mental illness, the stigma towards mental illness. The first one that I can think of is lack of knowledge. Yeah. Mental illness is not like any physical illness. We can't observe it most of the time. So there are lots of uncertainties about it. Individuals may seem very happy, very outgoing, very relaxed around other people, but they may be experiencing mental illness. So because we can't see it, we find it hard to believe it as well. And due to this, there is lots of uncertainty about how this individual could be someone who has mental illness when in fact they look absolutely perfect. So lack of knowledge is one thing. I think the beliefs that are associated with our cultural norms, values may be another thing that plays a role on stigma, and also the lack of effective policies that are important for reducing discrimination towards these individuals play a key factor.
Yeah, and you've worked with patients, so from working with patients, what is the most thing that you hear from people dealing with mental illness about the stigma and the discrimination they face?
Many of them fear going outside because they fear that if they do go outside and they're observed by other people, they may be noticeable, and if they're noticed, somehow they will be shamed in front of public, and this is very negative on their well-being because simply due to this fear, some individuals with mental illness do not want to seek help, do not want to carry on with the treatment. So it does have a significant impact on the quality of their lives. Yes, they may lose their job, they may drop out of education, they may become homeless. But it can also prevent them going outside and doing basic things like shopping or having a coffee with their friends. So it does impact on their lives in a very negative way, unfortunately.
So this is interesting to me. Some professionals mentioned that the use of the word stigma itself stigmatizes. It implies that there is something to be stigmatized. The word discrimination, on the other hand, has a satisfying legal ring to it. Do you think replacing the word stigma with discrimination would be more effective while educating the public?
I think replacing one negative word with another negative word is not going to be effective. I think rather than trying to replace stigma as a word, I think we should try to get rid of it altogether and maybe bring more compassion, more empathy, more knowledge about mental illness so that people actually become aware of the fact that mental illness is not something to be feared of. Individuals with mental illness are not people to be avoided of. So we should, I think, focus on developing things like compassion or empathy rather than trying to replace stigma with discrimination.
That's so true. So it is essential while educating and raising awareness to indicate why stigma exists. We know that just stating fight stigma is not enough. So besides educating the public, what other steps can we take to eliminate the stigma?
I think effective policies play a great role. For example, in Cyprus, the Turkish-speaking side of Cyprus, have a policy that is from 1930. So that is a very old policy. Many things have changed about mental illness. We now know more things about mental illness. We know that these individuals are not crazy and idiotic as it is described in the policy of Turkish-speaking Cypriot community. So I think we need to start changing the policy and actually forcing anti-discriminatory laws that help us, professionals, fight with stigma towards mental illness in more effective ways. We should also try increasing awareness of the public. Yes, I can speak about mental illness and I can tell them, look, this is not something that you should be fearing of. But if public don't see it themselves, perhaps through the eyes of individuals with mental illness, I'm not going to be convincing them that this is something they shouldn't be fear of. So maybe we should encourage people with mental illness to come and speak about their experiences, perhaps share us their path that they followed in their treatment and show us that they are capable of doing things just like any other members of the community.
Like we give them a chance.
Yes, definitely.
What are the dimensions of life qualities that will be affected by the type of the discrimination? And to what extent can the stigma be controlling and interfering in your rights? Like, for example, like as you mentioned, being accepted in a job and all those qualities.
I mean, stigma affects every aspect of one's life. As I said, many people don't want to employ those who have mental illness because they simply think that they're not capable, which is in fact untrue. People with mental illness may not be given the equal chance as others for education, or they may not want to go and get educated because they fear that they are noticeable and if people realize that they will be discriminated. So there's this fear that prevents them from doing what they are actually more than capable of doing. So if you ask me what stigma affects, I will tell you it affects every aspect of individual's life, from employment to education.
So speaking about these groups being discriminated, which groups regarding mental illness are stigmatized the most and why?
I think individuals with schizophrenia, individuals with bipolar disorders are stigmatized the most, simply because of, I think, the media representation of these illnesses. They are the group which are spoke about as being the most dangerous. These individuals commonly referred by media, at least the Turkish media, that they are potential murderers, rapers, and they're just dangerous individuals that we should definitely avoid from. So media plays a great role on developing these beliefs and keeping the myths about individuals with mental illness, but particularly for those who have schizophrenia or things like bipolar disorder.
So this all misinformation that someone with a mental illness like bipolar and schizophrenia being under treatment cannot lead a normal life and carry out daily functions. Is it scientifically true?
It's absolutely untrue. As long as these individuals have access to effective treatment programs, they can lead normal lives.
Yes. So how has the stigma around mental illness changed from when you started your work?
The one thing that we realized, well, I started working on this field 8 years ago, and when I started, there was little knowledge about mental illness and what this was about and how we could explain these individuals to the public. For example, one of my research questions was, how would you describe someone with schizophrenia? And many of my clients, when I was interviewing them, they said, is someone who forgets things, is someone who cannot go out because they don't remember how to find their house bags. So it fits more to the dementia type of description. So there was lots of unknown about mental illness. But today I think people do know more about mental illness, what they are. Maybe if I ask someone to define depression, they may be able to give me appropriate definitions. But unfortunately, this is not enough to get rid of stigma, because just knowing what depression is not going to make me like someone with depression or not discriminate someone with depression. I think we need to start working on increasing awareness using factual knowledge, and as I said, maybe encouraging individuals with mental illness to share their stories with us, particularly their treatment journey with us, so that we can see this is something that can be treated, and if you can access treatment, if you have these options, you will be okay. You can carry on with your life.
So with the information that we have today, like there's a lot of awareness and like people are covering up the mental health issue like quite better than before. But do you think people are aware when they are perpetuating the stigma regarding mental illness, and or do you think the stigma is unintentional in its nature?
Stigma and discrimination can be obvious. It can be directed. For example, if I make a negative comment towards someone with mental illness due to their illness, that's me being intentional. But I can do it unintentionally as well. So I may unintentionally avoid individuals with mental illness, or I may make my child avoid when I see someone acting strange unintentionally. So it does have intentional part and unintentional part as well. And fighting the unintentional side of the things is always more challenging. That's why I keep saying we need to bring awareness, because that's one way of fighting with unintentional stigma and discrimination.
So where we stand today, how can we improve more, and how can we get rid of the stigma?
I'm not sure if we can get rid of the stigma, unfortunately, because these myths will always be in the community. They will always be kept through media or through other, through particular groups. But I think we can reduce it by, as I said, increasing awareness, by changing our policies and forcing anti-discriminatory policies on particularly mental illness, and just by talking about it. We need to be more open about our problems, particularly mental health problems, because it's very common. 1 in 4 people will experience mental illness at some point in their lives. So we must talk about it so that when we do experience it, we know what to do, we know where to go and how to seek help.
unfortunately. But we'll keep the education going on. Like it's going to be an ongoing problem.
Yes.
All right, so we're coming to an end, but before we finish, let's talk about COVID-19 situation that is happening nowadays. And a lot of students are undergoing mental health problems. However, stigma could be preventing them from seeking help. What are the advices can we give people about that?
I think the one thing that we can say to both groups is that they should know that they're not alone. They're not the only one experiencing these issues, and these issues will be experienced by many people. So knowing that they're not alone, it is possible to recover from both COVID and mental illness. They shouldn't be, this is not something that they have done and because of something terrible that they have done, this happened to them. It's not something like that. It's an illness just like any other physical illness. So they should get treatment. Realizing the problem and getting treatment is always the good starting point, and there's nothing to be feared of about mental illness.
Yes, and some like in some communities, I've heard like some people are running away from the hospitals even. Like people are scared. It's a natural reaction, I understand, but we need to raise awareness about it. So the being infected itself and the stigma about it. So what can we say to people about this? Like being infected and feeling shame of being infected, or being scared that people would look at them differently. What can we say about this exactly?
I think if the more they hide, the more stigma that will be around the communities. We need to see these people. We hear about these things. We hear about the fact that they can infect us, but we never talk about the fact that we may be the carriers. We may just not show any symptoms. And rather than saying infected, we can say things like this disease can be transmitted. It's not something that humans do. It can be transmitted. And we wouldn't do it intentionally, of course. So the more they hide, the more they run away from hospitals, refuse treatment, the more stigma that they will face. So yes, we need to increase awareness. We need to do more as a community. We need to be more compassionate, more empathetic, more understanding, but we need to see these people as well. So they should come forward rather than running away to help us reduce stigma towards these conditions.
So the fact that you run away itself like sparks the stigma.
It does affect the uncertainty about the condition, and the more uncertain a condition is, the more fear we do have as a community. So I think hiding away is not the best thing to do in these conditions.
So we're coming to our final question, and I don't want this to end, but it's coming to an end. So as a final advice to students in the context of the recent crisis, what can we say?
Firstly, I want them to stay well, keep safe, and make sure that they're practicing social distance and listening to every advice that is being put there. And they shouldn't believe in rumors. They should always follow the established sources. And if they do need help, they shouldn't fear of asking, because we are in a very uncertain situation at the moment. We do all have fear. Simple things became a big issue for us, like going to shopping is a big issue for me at the moment. I do fear myself. So if they're in a situation that they feel like they need help, they should ask for it and they shouldn't hesitate.
Indeed, and thank you so much, Ms. Akilit. It's been a pleasure to have you here and an honor. I hope people learn as much as I have learned from this, and thank you so much.
Thank you so much for giving me the opportunity, Ravan.